Today we are discussing breastfeeding campaigns, who they target, why breastfeeding is important, and how they relate to health behavior theory. Why is it so important to breastfeed? Breastfeeding has several benefits for not only the baby, but for the mother as well. In babies, breastfeeding will lower ear and respiratory infection rates, lower the chance of sudden infant death syndrome, and lower diarrhea occurrences. In the mother, breastfeeding will decrease the chance of breast and ovarian cancers. Common barriers cited for not breastfeeding include lack of knowledge of how to breastfeed and its benefits, poor support from the family and the community, breast pain associated with breastfeeding, embarrassment of breastfeeding in public, and not being able to breastfeed or problems pumping when the mother returns to work. Both the World Health Organization and the American Academy of Pediatrics recommends infants receive exclusive breast milk for the first 6 months of life. Breastfeeding with complementary foods are then recommended for as long as both mother and baby are interested. The American Academy of Pediatrics recommends breastfeeding continue for at least 12 months, while the World Health Organization recommends at least 24 months. The following campaigns all target pregnant women, both before they give birth and after. Healthy People 2020 target goals are for 81.9% of women to initiate breastfeeding, 60.6% to breastfeed for 6 months, and 34.1% to continue breastfeeding for 1 year. The Baby Friendly Hospital Initiative was chosen as an excellent campaign. This initiative began in 1991. It was launched by the World Health Organization and UNICEF as a global program aimed to encourage the implementation of the 10 steps to successful breastfeeding, as well as the International Code of Marketing of Breast Milk Substitutes. Baby Friendly assists hospitals in giving mothers information, confidence, and skills necessary to successfully initiate and continue to breastfeed their babies or safely feed with formula. A special designation is given to hospitals who prove that they follow all 10 steps. The campaign's basic tenets are human milk for human babies, birth facilities that are responsible to protect both mothers and infants. Families deserve to receive evidence-based information regarding their feeding choice and to be respected for the decisions made. The Baby Friendly Initiative seeks to change multiple determinants across multiple levels within the ecological model. Within the campaign, constructs from 3 series are evident: social cognitive theory, health belief model, theory of planned behavior. Steps required to complete the baby-friendly designation are as indicated. Steps 1 and 2 involve the environmental construct in the social cognitive theory and include the outer and middle rings of the ecological model. Steps 3 through 9 add the health belief model with perceived benefits and affects the behavior, environment, and personal factor constructs in the interpersonal ring. Step 10 brings together the theory of planned behavior by fostering the establishment of breastfeeding support groups and affects the middle ring of the ecological model, those people close to the mother. The next campaign we are going to discuss is a fear appeal, co-created by the U.S. Department of Health and Human Services and the Ad Council. It was called the National Breastfeeding Awareness Campaign and ran from 2004 to 2006.
Our opponents today, Katie is 9 months pregnant, and Jenny's about 8 and a half. Balance could be an issue here, but both women are strong competitors. Moving their feet quickly on top of the lawn, trying to dislodge their opponent with quick maneuvers. Western Red Cedar is very explosive.
Recent studies show babies who are breastfed are less likely to develop ear infections, respiratory illnesses, and diarrhea. Babies were born to be breastfed.
This campaign utilized constructs from 2 different behavioral theories, the Health Belief Model and the Extended Parallel Process Model, or EPPM. The Health Belief Model has four main constructs: perceived severity, perceived susceptibility, perceived barriers, and perceived benefits. Perceived severity is addressed by the video itself. It shows a woman potentially endangering her unborn child and relating that severity to not breastfeeding. Because they show pregnant women, this addresses those that are potentially susceptible to this issue. Lastly, at the end of the ad, it addresses several perceived benefits to breastfeeding. It does not address perceived barriers. The second model it utilizes is the EPPM. A fear campaign needs to create a sense of high threat to the individual and also give a sense of high efficacy or a way for the individual to be able to counter this threat to be effective. This ad video does not do this. Instead, it relies on a high amount of threat to the child, but portrays a sense of low efficacy by not providing a woman the belief that they are able to counter this threat. This, in turn, creates a fear control process where the woman may become defensive and shut out the message. Therefore, this campaign should only be considered an average campaign. The last campaign we will discuss is an ad campaign done by the Mexico City government in 2014. These ads portrayed actresses and a female boxer topless with a tactfully placed banner that reads, "Don't turn your back on them, give them your breast," all in Spanish. This campaign used a few parts from the social cognitive theory and used social norms from the theory of planned behavior. Observational learning and self-efficacy from social cognitive theory were trying to be addressed by using role models to show the importance of breastfeeding. It does not show them breastfeeding, and so the ad itself could be for just about anything, with just the addition of a different banner. This does not help with observational learning, as there is nothing for them to observe. This doesn't help much with self-efficacy, since it is more a verbal persuasion message, which only helps those who are already leaning that way. Other women who are not convinced may become defensive with the message. At last, construct used is social norms. The ad tries to show that it is acceptable to the public to breastfeed. Again, it failed to show that breastfeeding is a normal thing to do. It is for these reasons that we felt this is a great example of a poorly done campaign. We believe the social cognitive theory is the best theory for creating breastfeeding campaigns. Many of the constructs pave a way for many of the excellent campaigns to be effective. The construct of reciprocal causation is very important because it takes into account multiple issues affecting breastfeeding. First, the environment is affected by the hospital personnel, and so their policies and training, as stated by Baby Friendly Hospital Initiative, are influential in breastfeeding success, which leads to the person and the self-efficacy, outcome expectations, and knowledge constructs, and lastly, the environment, with observational modeling and sociostructural factors. References follow.